Oh.
Alright, I think we're back on.
No, this is not live.
Alright, I got us back on Facebook.
Yeah, I can see.
Should be coming back on YouTube in a second. Alright, we are back on YouTube, and we are back on Facebook.
You want to check and see whether it is live or not?
Yes.
YouTube is live. You want to turn on the phone, you can watch too.
Alright, we're live on there. We're live on Facebook and
YouTube. See on YouTube, like it looks like, yeah.
Alright. There we go.
Yeah,
we are live.
Okay.
Apologies for that technical difficulties, but we are back.
Thank you guys. Thank you for patiently watching. We appreciate that. I apologize again for the technical difficulty.
Let's just dive back in then, shall we? Let's go to an Instagram question. This one comes from Sidera Swan. Question is, bridge or implants?
So the question is, bridge or implants? So the answer is, you can get either, but whether you want to get the best treatment possible, or you want to kind of like the old conventional type of treatment. If you are looking for the most innovative and the most conservative treatment, and that would be the implant. And this is the least invasive treatment also. But in case if you are thinking of considering the bridge, it is not that you cannot do the bridge, but then that's going to be an invasive type of treatment. For example, I don't know how well you can see, anytime you're going to have a bridge, then you have one tooth in the front, one tooth in the back, then you are going to solder down the tooth in the front and the back, and then that's the only way you can get the bridge. However, if you are considering an implant, which is the best and the most innovative and the least invasive way of doing that, would be to, you don't have to touch the two teeth on either side. All you have to do is like you put the implant in the bone where the missing tooth is, and then you kind of get a crown on the top. So if it is my own mouth, absolutely bridges are not an option at all for me, and I always recommend my patients get the dental implants. But if you have other concerns, and if you're for any reason not thinking about dental implant, my recommendation is to seriously reconsider your option to get the dental implants done. And then one other thing I would highly recommend you do is like, think about this. I always tell my patients, hey, think about the technology. So compare the bridges to an old flip phone versus having a smartphone, which is the most modern technology, which is a smartphone. So if I were to give you the option, would you rather consider getting a flip phone or you would consider getting a smartphone? I'm sure the answer would be a smartphone, just the video that you're watching now on the smartphone right now. So if you're kind of a person, you're looking for the most innovative and the modern technology, then implant is the way to go. That's what I would highly recommend. As you know, most of the patients that we get to our offices, and they are definitely considering implant, and they are not considering bridges at all. Yeah. And if you're considering bridges, or if you have any kind of a financial concerns to not to be able to invest on a dental implant, my recommendation is you try to get a flipper or like a temporary tooth replacement, or even go with no teeth at all, and try and see whether you can save up some money and to get the implant eventually. That way you will end up eventually saving more money in the long run.
Yeah, a bunch of our new patients come in because they're unhappy with their bridges, or they're looking for bridges, but they get convinced that implants are just the better option.
Absolutely, yes sir. Yeah.
All right, let's go back to Facebook for another question. How long do the implants last?
So the question is, how long the implants last? I tell my patient this is one of the most common questions that gets asked in my office all the time, because implants is what we do all the time. So I tell my patients this is the exact same answer I give every single patient. Implant lasts for a lifetime, but I complete the sentence by saying implants last for a lifetime as long as you take good care of them. So the good thing is implants don't get cavities because they are metal. Implants don't get root canals because they are metal. However, implants can get some gum disease around them just like your regular teeth. So if you are not going to take good care of those implants by professional cleanings and brushing and flossing around the implants, you may not get cavities or root canal, but you will end up getting some gum disease around the dental implants. And whenever you get some gum disease, you get some bone loss. As you know, you probably lost a tooth because you had some gum disease to begin with, and that's the reason why you're going to end up having the implant anyway. And if you're going to repeat the same habits by not brushing or flossing or not going to the dentist for a professional cleaning every 3 to 6 months, then you may end up losing the implant for the same reason. So to answer your questions, implants do last for the lifetime as long as you take good care of them.
All right. Let's see. Let's do another Facebook question. This one comes from Salim Rajani. His question is, I have to extract my wisdom teeth. Do you treat with local anesthesia? And do you extract all teeth in one seating?
So the question is, I have to extract my wisdom teeth. Do you treat with local anesthesia? Do you extract all teeth in one seating? So this is the 3-part question. So the first part of the question is, I have to extract my teeth. Actually, 2-part question. So do you treat with local anesthesia? The answer is yes. So the anesthesia is just a preference, and I do have a lot of patients in my office, and they were told by other offices, and they have to be put under to get the wisdom teeth removed always and always, and not necessarily true. There are some occasions you are able to get the wisdom teeth out, and just with the local anesthesia. When I had my wisdom teeth removed and I had local anesthesia, I was able to get on the chair. When one of my colleagues did the procedure, I had the procedure done in the morning, and I was back in the chair, back in the office treating patients just in the afternoon. If I had the choice, I prefer to have in my own mouth. I want to have the procedure done with the local anesthesia, because I don't have to go through the trouble of having to fast for the procedure. Then after being sedated, then I have to have somebody drive me here and take me home and all of that. But it may not be the case every single time. Sometimes either you may have some infection or your teeth may be difficult. It may not be a most comfortable experience to have the procedure done under local anesthesia. In those cases, I do recommend that you need to be put to sleep. When you have infection, we cannot get you completely numb, or your teeth are tough enough and we are not going to be able to provide a comfortable experience. Other than those type of situations, to answer your question whether the teeth can be removed with the local anesthesia, absolutely yes. Give you some stories. And I had my brother-in-law and my sister visiting me from the UK about 2 years ago, and both of them, they were visiting me for like a very short period. I ended up removing their wisdom teeth 2 days prior to they were leaving to the UK, and I did not want to sedate them at all. Both my sister, both my brother-in-law, they had their wisdom teeth removed just with the local anesthesia. They had absolutely no problem at all, and I did not even, as a matter of fact, see them for the follow-up. After a couple of days, the second day, or actually the third day, they had their flight back to the UK, and they did fine. And I do have a lot of patients in my office, and including some of the anesthesiologists or the nurse anesthetist, and they don't want to be put to sleep, knowing that those are the people who put patients to sleep all the time. They know what an inconvenience could be sometime to have the patient sedated for some type of procedure. So you can definitely have those procedures done very safely under local anesthesia. Absolutely.
Yeah, and we also offer some special discounts for if you're getting all 4 of your wisdom teeth currently. We'll offer that free IV sedation.
Absolutely. And to just to mention, thank you for saying that. To just to kind of to add a comment onto that, the sedation comes like in multiple ways. For example, IV sedation is the one I was talking about earlier that you need to be put under. But you have other types of sedation. For example, like the laughing gas sedation, which is we call it as the nitrous oxide sedation. You can just come to our office and you can have that type of sedation. You don't need to be. You don't need to have somebody drive you here. You don't need to be resting, or you don't need to be like groggy for the rest of the day like the IV sedation. You can have those type of procedures done safely. You can drive here, get the procedure done, go home on your own. That is another option if you're really considering some type of anesthesia for the procedure.
Mm-hmm. All right. So let's go back to Cora for another question. How can dental implants improve my chewing capability and also my jawbone structure?
So the question is, how can dental implants improve my chewing capability and also my jawbone structure? So the question is, when you have some lost teeth or when you have some missing teeth, so you're not going to have the same type of chewing that you had. I have a lot of patients in my office, and the moment I see them, I can see that they got some missing teeth, and I ask them, if, for example, when they have some missing teeth on the right side, I ask them a question, hey, which side you primarily chew? And they don't realize, why I'm asking the question. Automatically they will say, I do most of my chewing on the left side, and so immediately we know, and I go back and ask them, hey, just like you said now, you are doing most of the chewing on the left side, and as you see, you got some missing teeth on the right side. That's the reason why you need to have some teeth replaced with dental implant. So to answer your question, do dental implants doing your improve your chewing capability? Absolutely yes. So for example, on that patient I was talking about, as soon as we replace the teeth on the right side with dental implants, and we see them months after the teeth replacement, they say, hey, my chewing is back to normal. And as a matter of fact, like patients ask me the question, well, hey, what are the advantages of dental implants? And I tell them, and they look, feel, and function like a natural teeth. Function, one of the main functions of the teeth, as you know, is the chewing. So you definitely, absolutely get 100% of your chewing back by getting the dental implants. And then how do they maintain the jawbone structure? So in our office, we do have a lot of patients, they had these missing teeth for a long time. As you know, one of the most common things that happen is once you lose teeth, the jawbone tends to dissolve away or erode away. When the jawbone starts to erode away, then you get that sunken appearance of your face, because the bone keeps sinking and the chin or the cheek keeps sinking also. So when you have those dental implants, you prevent the bone loss and you prevent the jawbone from eroding away. So therefore, you're going to prevent the sunken face also. So to answer your question, you're absolutely going to get the chewing that you need, and you're absolutely going to prevent the jawbone erosion, and you're going to absolutely keep the jawbone structure by getting the dental implants. Absolutely.
All right. Next question, back to Facebook. This one comes from Leon H. Green. This question is, how much are implants?
So the question is, how much are implants? So the answer would be, the implants in my office, and I tell my patients implant can be as low as about $999, or it could be as low as about $99 a month. So depending on what type of implants that you need. If you need a straightforward implant, sometimes we do run specials and we can bring the cost of the implants down to about $999. Sometimes patients I have seen in other places, they got the dental implant including the crown and the abutment. They got the whole thing done under like about $2,000 to $3,000. So depending on what type of implants you get, and how many number of implants you get, and where are you going to get the implant, whether those implants are going to be done at a specialist office or it is going to be done by a general dental office. So those are the type of situations which are going to determine the cost of the implants. So as a specialist, we do a lot of implants in our office. Our cost is going to be slightly higher than some other places because of the quality and the reputation that we have to maintain in our office, because a lot of doctors refer patients to our office, and then we need to maintain the standard of care and our reputation and the quality, so we don't do any knockoff brand of implants. And I tell my patients, all our patients come straight from Sweden or straight from the USA. So those are the type of implants that we do. So we have to maintain the standard. So our cost may be slightly higher because we do pay a premium price for those type of implants that come from the US or Sweden. So some of the implants that are being done in other places, they are knockoff implants and they come from China or Korea or Malaysia or Egypt, other places. And not to be offensive to those places, there are some good brand implants also, and they are even FDA approved implants. But those implants can be less expensive, and some doctors are able to place those implants for a slightly less expensive price. So to answer your questions, implants run as low as about $999 per implant, and depending on the place you get, they can be as high as about $3,000 to $4,000, or maybe even more if you are going to need some kind of a bone graft or anything any other additional treatment in addition to the straightforward implants.
Yep, and come give us a visit. We'll get your cost.
Absolutely, we can get a very accurate cost and estimate of the implant that you're going to need. Absolutely, yes, sir.
All right, next question. Let's do another Quora question. Are there any treatment for failed dental implant cases?
So the question is, are there any treatment for failed dental implant cases? So the question first is, do dental implants fail? Well, dental implants have a very good success rate. In our office, we have a success rate of about 95 to 97%. However, do implants fail? They do fail. So implants fail for a number of reasons. Implants fail because the bone does not fuse around the implant, or sometimes we do place the implants good enough, but the patients don't come back for a follow-up, or they don't come back for the follow-up cleanings, or they don't maintain the implants well enough, or they continue to smoke, or they get some medical issues. So for a variety of reasons, implants fail. So what are the treatment options when those implants fail? So when the implants fail, the most conservative treatment that we try to do is we try to salvage the implant. There are a number of treatments available, such as a laser treatment that you can do around the implants, or some kind of a gum surgical procedure, or some type of bone grafting procedure that you can do around the implant to salvage the implant. However, if the implants are not salvageable, sometimes we may end up removing those implants and doing some bone grafting procedure. That way we can go back and replace those implants also. So here's the catch. Just because the implant failed the first time, it doesn't mean that it cannot be replaced. Sometimes, like I said, we are able to salvage them, or even if we have to end up removing them, we can do the bone grafting, and then we can always go back and replace those dental implants. And I hope this answers your question.
All right. Let's do another question from Quora. I have lived with my dentures for years. Is it necessary to switch over to implants, or can I continue with my dentures?
So the question is, I have lived with my dentures for years. Is it necessary to switch over to implants, or can I continue with my dentures? So this is one of the common things that I see in my office. Patients sometimes come to me with absolutely no bone at all, and they are wanting some implants because, as you might know, for patients who have dentures, the dentures are not the most comfortable thing, particularly the regular dentures. This is what I'm talking about. I always tell them the dentures are like flip-flop, and they don't stay around, and that's the reason why we recommend you get implants. And the implants kind of snap in just like that. Not only that we recommend you place the implants to snap in your denture, but also to retain the bone. Like I said, if you don't have the implants over a period of time, the the bone underneath the denture, it starts to deteriorate over a period of time. So if you're, let's say for example, if you were 30 or 40 years old and you got a denture at 30 or 40 years old and you lived along with the denture for 20 years, and now you got possibly some decent bone remaining for us to be able to place the implants. Let's say you continue to wear the dentures for another 20, 30 years, and then now you're about 60, 70 years old. Now your denture absolutely does not stay at all in your mouth. Now you're wanting to get some implant. At that time, you may not have enough bone at all to be placed, to have some implants placed. So depending on the type of bone, and if you have good bone, you get by for a number of years, 20, 30 years without the dental implants? The answer could be yes. But more and more patients that we see here, many number of patients that we see here in our office, they require some type of bone grafting if they have lived with the denture long enough. So we always recommend not taking any chances. If you are able to fit the implants into your budget, I always recommend get the implants as early as you can. That way you can continue to stay looking young, and that way you can prevent the bone loss, and also you don't have to ever worry about not having to have the problem of not being able to get implants at all because you don't have any bone. So it's always prevention is better than cure. That's my recommendation.
Yeah, I would say dentures are slightly just quicker fix than that.
Absolutely.
Yeah.
Yes, sir.
All right. Let's do another question from Facebook. This one comes from Marva Lynn Rose. Her question is, she says she's a 70-year-old with gum disease with a bad heart and she is needing dental surgery. So I guess she's just asking how possible is it for her possibly?
Absolutely. So the question is, 70 years old with gum disease and she has a bad heart and then she is needing dental surgery. I'm assuming she's asking whether she can have a dental surgery done. There is absolutely, or I should say, very minimal contraindications for having any type of dental surgery done. So matter of fact, like just before coming to this live show, I had a patient that he had a very severe cardiac condition and we had to have some dental implants done and actually have an infected tooth removed before he gets a dental implant. I had to consult with this cardiac cardiologist to get a consultation whether he's a candidate for having the dental procedure done. The cardiologist gave a consult and then he cleared him to have the dental procedure done. In that patient's case, the patient was having to take some blood thinners. The cardiologist recommended patients to stop the blood thinners a couple of days prior to the procedure, and the patient is going to come in for the procedure. So to answer your question, whether you are a 70-year-old or whether you are a 90-year-old or a 17-year-old, it does not matter if you have any cardiac issues or whether you have a bad heart or any other medical issues. For the fact, we can definitely consult with your physicians who are treating you to see whether you are a candidate to have any type of dental surgery or not, or even if you are not a candidate, what can we do to make you a candidate to have the dental surgery done. That way we can do the procedure safely. For example, like I said, on this particular patient is taking a blood thinner. It is not safe for him to do the dental surgical procedure without having to consult with the physician, but we were able to consult with the physician, get a recommendation. That way he stops the blood thinner few days prior to the procedure, then we are going to have the procedure done safely. So any type of medical condition, including a bad heart, we can make you as a fit candidate to have the procedure done by consulting with your physician. And come and see us for a consultation or talk to your dental team and they should be able to help you.
All right. Let's keep on Facebook and go on the opposite end of the spectrum. So this question comes from Katina Franklin. How do I keep my child awake during sleep apnea?
So the question is, how to keep my child awake during sleep apnea. So I'm not sure what this reader is exactly referring to, or this follower is exactly referring to. Um, Whether she's trying to keep the child awake during sleep apnea. Well, if your child has to sleep, the only question that I have is, I'm assuming that she is asking how to treat sleep apnea. So that would be the most appropriate question. So to answer your question, how to treat sleep apnea on a child, so there are multiple treatments available for sleep apnea, even for children also. So first thing is, your child needs to be diagnosed whether the child has sleep apnea or not. So my recommendation first to find a sleep physician. For example, in your area, you may have a sleep physician or a neurologist, or there are some sleep centers that you can take your child to, or maybe talk to your physician to see whether they do any type of sleep study. So as soon as you diagnose, or as soon as they undergo the sleep study, they should be able to diagnose whether your child has sleep apnea or not. As soon as you find out whether you have sleep apnea, there are multiple ways the child can be treated, including a dental appliance. So if you are going to need any type of other treatment, like for example, we have a positive airway pressure treatment, or the CPAP, and if you are going to need that, then your sleep physicians will be able to help you. Or if you are going to need some type of a dental appliance to treat the sleep apnea, then you are welcome to come into a dental office like us, and we should be able to tell you whether your child is a good candidate for any type of dental appliances for the sleep apnea treatment.
Young or old, we can help you. All right, let's go to Cora for our next question. Let's see. How long does it normally take to complete the dental implants procedure? When can one return to work after the procedure is done? Also, can I be given temporary teeth in the meantime during the procedure duration?
So the question is, how long does it take normally to complete the dental implants procedure? When can one return to work after the procedure is done? Also, can I be given temporary teeth in the meantime during the procedure duration? So this is a three-part question. The first part of the question is, how long does it take normally to complete the dental implant procedure? Sometimes the dental implant procedure be done on the same exact day. For example, you can have, let's say you came with a broken tooth, you fell down, you broke the tooth, and the tooth is it's a clean, straightforward procedure. You don't have a lot of infection. We are able to remove the tooth and put the implant in the same time, and we are able to give you the temporary even on the same day. It's all done within 1 hour, and sometimes if you go search for like a 1 hour tooth, and you may be able to find some searches on Google that it will explain what a 1 hour tooth procedure means, meaning remove the tooth, put the implant, and then give you a temporary on the same day. But let's say sometime you have a tooth, but the tooth has a lot of infection. Now you cannot place the implant at the same time. Then you need to have the tooth removed. Then you need to have some type of bone grafting done, and then followed by the healing of the bone graft. Now you need to have a dental implant done. So this may take 3 months for the bone healing and another 3 months for the implant. So sometime it may take up to 6 months. So you may not have a temporary tooth for a 6 months period that is put on the implant. However, we do have some options as far as we have some clear trays like this in our office that we are able to deliver on the same day, or we do have what we call it as a flipper tooth that we are able to give you on the same day for those type of patients. So to answer your question, you are not going to have you're not going to be toothless for any period of time at all. You are going to be able to walk out with the temporary either on the same day or possibly the next day, either with this type of a plastic or with this type of a flipper. And then the second part of the question is, when can I return to work after the procedure is done? To answer that question, most of my patients, they are able to go back to work, as you know, the same day or maybe even the next day. Most of these 1-2 procedures, for example, are 1 or 2 teeth procedures. They can be done just with the local anesthesia. That means you're going to be numb a little bit, but you're able to return to work, and you're going to be numb anyway. Most patients don't even need stronger pain medication. You take some Advil or Tylenol and you go back to work on the same day. If not the worst case, the next day you're able to return to work. And then to answer the third part of your question, whether you're going to get a temporary or not, like I said earlier, you're going to be able to get an implant too right on the same day immediately after the procedure that is permanently put onto the implant. You don't even have to worry about removing, or if you are going to be given a removable appliance option as either a tray or a flipper, again you are able to get them as soon as the same day or the next day, depending on how your dentist is going to be able to deliver those type of appliances.
All right. Next question, back to Facebook. This one comes from Janin Whitmer McCandles. Do you offer free screening for dental implants?
So the question is, do you offer free screening for dental implants? Absolutely yes. We do offer a free screening. In our office, we do have a free CAT scan, a free consultation. In addition, unlike many other offices, not only just the free consultation, but we also offer a free CAT scan. When I say free CAT scan, this is not like a regular small x-ray that you're going to have done when you go to your dental office. It's not like a flat panoramic x-ray that you may have done in your dental office. This is a very tight, very specific, very specific and very special diagnostic tool, which is a 3D CAT scan or a CT scan that is available for a dental implant procedure, particularly to know exactly the amount of available bone to be able to place the implant. That way we can give you a very accurate treatment plan, whether you're going to need any type of bone graft or whether it is going to be a very straightforward procedure. So to be able to do that, then we do need to get a CAT scan done or a CT scan done. So not only you get a free consultation with our office or a screening with our office, we also offer a free CT scan or a CAT scan in our office, and you're welcome to see us, come and see us. If you happen to be in the Dallas-Fort Worth area, we do have 2 locations, one in Carrollton and the other one is in Grapevine. Visit our website at implantsgumcare.com and you should be able to get more information.
Yeah, come stop by. All right. Next question. Let's go back to Cora. How safe is dental implants? Can my teenage daughter go for it? Also, would it look odd or fake to outsiders?
So the question is, how safe are dental implants? Can my teenage daughter go for it? Also, would it look odd or fake to outsiders? So the answer is, the implants are safe. They are, I would say, 100% safe, and there are very, very few contraindications, and I would say 99.99%, I should say probably 100%, because there are very, very few conditions that implants are contraindicated. So for the most part, implants are pretty safe. And can your teenage daughter go for implants? Absolutely. As long as the teenage daughter has completed the growth period. For example, if your teenage daughter is about 12, then I would recommend 13, I'm sorry. If she's 13, then I would recommend you wait for a little bit longer until she completes the growth period, around like age 15 for the girls, around like about age 17 for the boys, before you go for the implants. And so it is safe on around that age for the kids. And then also, would it look odd to the outsiders? The answer is, depending on where it is done. And like like I always tell my patient, implant, this is one of the most common questions that I ask, that gets asked in our office all the time. As you know, Reese, implants, what are the benefits of the implants? I tell them implants are the closest replacement to the natural teeth, and they look, feel, and function like a natural tooth. And as I said, they are the closest replacement to the natural teeth, and they look, feel, and function like a natural tooth. As long as it is done correctly, Absolutely. There is no other option that would look as natural as a natural tooth. So depending on, again, the reason I keep saying depending on where it is done, and you got to make sure that you're going to visit a specialist like me to get the dental implant done, and you got to work with your family dentist and to get the color match and things like that to be able to make it as natural looking as possible. So if you happen to be in the Dallas-Fort Worth area, come and see us. We will be happy to help you.
All right, let's go back to Facebook for our last couple of questions. This one comes from Beverly Lee. Her question is, why does the anesthesia affect the body so badly?
So the question is, why do the anesthesia affect the body so badly? So the answer to this question, it could be as simple as, it could be the effect comes from the local anesthesia, which is the numbing that we normally give for patients, or it could be the anesthesia or the IV medications that we use for the anesthesia that can have an effect on the body also. For example, one of the most common things that I hear from my patient, whenever we give the numbing medication to our patient, their heart starts beating really fast, and sometimes it could be a little bit fast, and sometimes it could be really fast, and the patients get an anxiety attack. Patients got like really panicky because now they're starting to have their heart beat like really fast. So one of the medications that is in the local anesthesia that we use, or the numbing medication we use, that makes your heart kind of beat really fast. And like I said, if it beats like a little bit faster, you may be okay, but if it is really fast, then now you're going to have like a panic attack or some kind of an anxiety attack from that. But it goes away like after a while. However, sometime of patients, like it may last longer also, and that may be one of the reasons the patient may be asking this question. Hey, can you do something else? My heart beats really fast, from the numbing medication usually given at the dentist. So we do have some alternative medication that we can give you with a particular type of local anesthesia that does not make your heart beat faster. So if you do have those conditions, please talk to your dentist, and they should be able to give you some kind of an alternative local anesthesia. And the other part that I mentioned earlier, the IV medication that we use, and no matter what it is, so depending on your sensitivity to the medication, sometimes I may give like a very small dose, and you're going to get sleepy for the rest of the day. And sometimes I give a very high dose, and you're just able to walk out of the office absolutely no problem at all. So depending on the sensitivity, the anesthesia medication that we use or the sedative medication that we use may have a very short acting or a prolonged effect in your body. And then the other thing that I normally hear is, after we use the anesthesia medications, patients tend to have some type of a nausea or vomiting sensation, which is not uncommon from the narcotic type of medication that we use. So those are the most common things that we hear: patients feeling sleepy, or heart beating kind of fast, or nausea or vomiting. Those are the effects that the anesthesia, any type of anesthesia used in a dental office, can have on your body.
All right, I think we have time for about one more question. This last one comes from Facebook. It's from Laura Beckley. She wants to know, her question is, she is a single mom. She's 27 years. All of my teeth are broken or falling out, and she's never had insurance. Can we help her?
So the question is, I'm a single mom, of 27 years old, and all of my teeth are broken or falling out, and I never had insurance. Would you be able to help? So depending on the type of treatment that you are going to need. So sounds like if all of your teeth are broken, you may be in a situation that you may need all your teeth to be removed. Either it could be just all the top teeth, or it could be all the bottom teeth, or it could be a combination of all your top and the bottom teeth. And we can help you depending on the budget that you may have. You may be able to give you as minimal as maybe a regular denture on the top, and it could be as minimal as maybe 2 implants on the bottom. or it could be 2 implants on the bottom and then 2 implants on the top. Most patients that come to our office, we are able to help them with some kind of a budget or some kind of a lifestyle, some kind of a budget they're able to fit into a lifestyle. So our goal is to be, when the patients come to our office, and we are able to find a budget that is going to fit their lifestyle. We are not a cookie cutter office. When you come into our office, hey, we are going to give you a treatment plan. It's going to cost you $50,000. Hey, here we go. You walk out and you figure it out how we can pay for it, and then come back and get the treatment done. There are many offices do that, and in our office we don't do that. But if you are able to talk to your dentist and then explain your situation, they're able to work with you. Many dental offices that I know of, they're able to work with you on a budget that you're comfortable with, and like we do in our office. So, for example, if you're going to need all your teeth removed, and not necessarily you need to have to start with implants right away. So you may be able to get some dentures on the top, for example, maybe some implants on the bottom to begin with. Then you can wait on to get the top implants later, or you may not have the budget to get started with any implants at all. So you may need to get started with the regular denture. So like I said, talk to your dentist or come see us and explain your situation. Come up with a budget that you're able to fit your lifestyle, and they should be able to help you. Like I said earlier in the show, in our office we do offer a free consultation and a free CAT scan. You got nothing to lose. Come see us, and we can see whether we are able to offer a plan that is going to fit your budget, and we are happy to help you.
Absolutely. All right, so that does it for us tonight.
Well, thank you guys, and you guys been a great audience tonight. And as you guys know, we do this live show, the Truth with T, every month, and we are going to be back next year. So, like I said earlier, make sure to submit your questions through Facebook or Quora or Instagram or YouTube or our website. Go to our website implantsgumcare.com and look for Ask Dr. V, and you should be able to submit your questions, or go to our other website, thetruthwithteeth.com, and you should be able to submit your questions also. So, and again, we thank you very much for all your time, and we look forward to having those questions submitted so we can answer your questions for you, and see you next month. Thank you so much.
See you later.
And thank you, Reese. Appreciate it. Yeah.